Okay, last year we received positions for building the registry and doing drafting the policies and procedures and drafting regulations. This year, the implementation date is January 1st, 2016. So these staff coming on board will be to actually implement the program and to register all of those home care organizations. We projected 2,000, as well as all of those home care aides that want to be on the registry. They need to be background checked and provide their information on an application to be in the registry. So this proposal is just asking for the second phase of this project.
Could you respond to the question on bottom of page 17?
The stakeholders?
Yes.
Yes. Yes, we have held 3 stakeholder meetings. We had our first meeting in February of this year, and we've been holding monthly stakeholder meetings. We've been opening it up to, we've provided information on our website, people that want to join in these meetings just to be more transparent and informative so that they can be part of this implementation process. This is new for our department. And we'll continue to have these until we have full implementation.
On a monthly basis?
Yes.
Great, thank you. LAO, finance questions. Item number 5, BCP number 52, residential care facilities for the elderly, related legislation.
Okay, this BCP is requesting positions for several bills. I'll just briefly go over each bill. AB 1570 is increasing the training hours required for RCFE licensees and their direct care staff. So we've asked for some resources to develop the training programs, as well as the administrator certification applications, and to ensure that the certificates are accurate and comply with the regulatory requirements. SB 911 requires us to review and revise the administrator certification test every 2 years. We've looked at the curriculums, we've totally revised the curriculums, and we're proctoring the exams now. We're actually going into the trainings to we're monitoring to see if the vendors that have been hired to do the training are actually following what the regulations require. AB 2236 added three new categories of penalties. So the positions we requested for this was to provide the training for the LPAs on the new criteria for assessing these penalties. They had to create some new forms, et cetera. SB 1153 allows CDSS to put a ban on new admissions for accepting new residents when RCFE licensees does not correct violations that present direct, immediate harm to a resident. So there was resources added to that to update our regulations and to provide training. AB 2171 expanded the rights to residents that gives them prompt access to their records. We had resources that worked in collaboration with the stakeholders to develop the new standardized resident Bill of Rights and to revise our Title 22 regulations. That's it.
Any questions? LAO or finance? Great. Let's move on to BCP number 6. BCP 12, staffing to detect registered sex offenders in out-of-home care.
This BCP requests to convert our 4 2-year limited term positions to permanent. We've now been doing the workload and can ensure that we need permanent positions to complete this workload. The second question you're asking, how many addresses that we have matched in here, and since 2011, we've had over 10,000. We've had over 10,000 matches that required us to go further to see if there was actual residents residing in these licensed facilities. We receive about 460,000 matches, or not matches, data from Department of Justice monthly. And so of those, we continually do the searches and on a continual basis. So those staff are needed to continue with this process and do the further investigations if necessary.
Any questions? Moving on to item number 7, BCP 54, positions to implement Assembly Bill 388.
This bill requires CDSS to monitor the outcomes of licensing complaints for those facilities that are reported to law enforcement. So those facilities that have an average number of law enforcement complaints, for us to actually go out and do an inspection, at least at a minimum of once a year. Okay, and the second question of how these positions are coordinated with the continuum of care, we're expecting the continuum of care reform to provide multiple improvements, and we expect the number of group homes will be reduced. Although it's premature to say how that reform effort is going to impact the positions that were required under this bill. But we're going to closely monitor. They'll be doing oversight of these inspections of those homes that are identified. As the group homes are diminished, they'll still be providing training as we transition to the new process.
Got it. And Director Lightbourne, remind me the continuum of care reform process. What's the time frame in terms of rollout? I know we've talked about it, but I don't remember. I'm sorry.
The first parts of implementation start actually in July, when the rates, July 2015, when
What's your out year in terms of we're up in full implementation? Do we know?
The transition's supposed to start January 2017 with the expectation that we are, by the end of 2017 calendar year, that we are divided between SDRTCs and then step-down services.
Got it. Okay. All right. With that, LAO, speak now or forever not on this collection of BCPs, items 2 through 7. Nothing. Finance. We will open it up for public comment, actually for items 3 through 7, which are all budget change proposal requests. Any public comment? I'll entertain a motion. Is Senator Stone, is there a particular way you'd like us to do this to meet your need? Should we do them all, or would you like them? So I'll accept a motion from Senator Stone to accept the recommendation to adopt placeholder trailer bill language on items 3, 5, 6, and 7. Done. And I'll accept a motion from you, Senator,
So move on item 4.
on item 4, which is budget change proposal number 7. Okay, and so the vote will be recorded accordingly. Thank you. All right, thank you. Appreciate it. We're moving on from community care licensing to, again, item 5180, Department of Social Services, CalFresh. We'll hear an overview, which is informational. Hear one budget change proposal request, and move on to drought food assistance, as well as proposals for investment. Thank you. Got it. Good luck with that.
Chair Mitchell and committee members, as you know, CalFresh is one of the state's principal tools in addressing issues of poverty. Turn it over to Todd Bland, the Deputy Director for Welfare to Work Services.
Welcome, Mr. Bland.
Good afternoon. It's a pleasure to be with you. I think the sergeant just handed you a handout that we'll work from. I'll give you a brief overview, and then partway through the handout, I'll try to turn to some of your questions on page 23, and we can hop around. As Will said, I am Todd Bland, Deputy Director for the Welfare to Work Division at CDSS. On the second page of the handout, I tried to boil CalFresh down to one page. As Mr. Lightbourne said, it's a critical program. It's the largest program CDSS operates. Over 4.4 million individuals receiving the benefits. It was formerly known as the Food Stamps Program. It's an entitlement program, and it brings monthly benefits to assist low-income households in purchasing the food they need. Eligibility standards and the rules are set, and the benefit levels are set by the federal government. And there's 100% federal funding for the benefits. However, the admin costs are shared between us, between the federal government, state, and county governments.
So work requirements for CalFresh, is that set at the federal level, or do we do that?
The rules around what is expected, especially with respect to able-bodied adults, are set by the feds. There's a system of waivers. We can talk about that a little bit, or we're good for now.
Well,
Okay.
Let me tell you the question. You can
Okay.
tell me if you want to answer. So I spoke at the CYC, California Youth, the Foster Youth CYC conference this week, and someone stood up in the audience expressing concern about the work requirements for students who receive CalFresh. We were talking about the bill I carried, allowing homeless youth to be able to apply on their own for CalFresh. And in that context, she was expressing a concern that she felt it was unfair that college students have a 20-hour work requirement per week if they're in school full-time and trying to meet this work requirement in order to qualify for CalFresh. And I admit I was puzzled.
I think I'm going to have to get back to you on that one.
Okay.
I'm a
Thank
little
you.
short staffed with the
That
absence
would
of
be helpful.
Linda Patterson.
Thank you.
But let me say the issue of students and implementation of 1930 and those bills, those are priorities.
Perfect, perfect.
But let me get back to you with
Okay.
better
I
information.
appreciate that.
Turning briefly back to my handout, the benefits, well, just because later we're going to talk about SNAP Ed, I'll introduce, SNAP is the federal name, Supplemental Nutrition Assistance Program. Finally, as I think everyone knows, the way the benefits are delivered, they're on the EBT card, and I think there's going to be a later issue in your agenda to be talking about the procurement of the next EBT system. The next slide sort of deals with participation. CalFresh participation is a priority for the administration and growing it, and in California, it has been increasing. We're now at over, as the handout says, over 4 million recipients and $7.4 billion, but that's enrollment. Participation, measured as how many of those eligible for the program are actually receiving the program, that measure we are not doing nearly as well on. We are at 63%. From the data from 2012. And that is, I think, admittedly, second from the bottom. However, what I can point to that's going in the right direction is from 2011, we increased by 8 percentage points in California, and whereas the national average only went up by 5. So we are moving in the right direction. I would also point out that 2012 is now over 2 years ago. And since then, a lot has happened. There's a graph on the next page that just sort of shows caseload growth and how our caseload growth has continued while the national program has leveled off. That doesn't prove that our participation rate is rising because I don't know how fast eligibles are rising. No, this proves the numerator was going up, but the denominator might have been going up too. But it definitely points that we're headed in the right direction. I'd also like to just step back for a moment and talk programmatically. Some of the major things that have been done over the last several years, one of them was done in 12, and that was the elimination of fingerprinting. What didn't, and essentially, but what other legislative change that was made was to move to what we call semi-annual reporting every 6 months rather than every 3. That should assist clients. It reduces the paperwork requirements for them to resubmit. In other words, only if they cross a certain threshold do they need to submit. And by doing that, we joined the other 49 states. But that didn't go into effect until October of 13. So I believe there's certain statutory things that have gone into place since then that haven't that aren't showing up in our numbers. I know you have a question about participation, so maybe I'll turn to that rather than moving to the outreach piece. Or unless you had were there other overview questions at this point? Okay. Well, let me try a little bit to answer your first question about how we partner with agencies and how we, to increase participation.
I can do it later if you want. But,
Go ahead.
oh,
Go ahead.
okay, thank you. I appreciate that. So, first of all, I appreciate your presentation, and I know it takes a lot of effort to get to 2 million households, recommending 4.4 million people with an annual budget of $7.4 billion. But I want to get back to the participation rate, and I'm concerned about that. At 63%, and the national average is 83%. Are we failing in a way in which we're sending children to bed hungry or seniors to bed hungry? How are we reaching out to these people that are not following up with these resources that are available to them? I'm just puzzled in seeing this for the first time.
That participation is low. Again, we're transparent about it. It's something we want to improve on, and we think the numbers are going in the right direction. There's a lot of things that we're doing to increase participation, and I mentioned a couple of the statutory ones. But there are other initiatives to simplify the program, and also a lot of different kinds of outreach measures to seniors, to different targeted groups. I think what ties it all together is something that I think we talked about a year ago with the committee, which is you get what you measure. And what we created was the data dashboard, which essentially allows anyone, and it's completely transparent, and legislative members, staff, public, anyone can go look at it. But what it really does is it shows you the state numbers on key things like how many seniors are you reaching? What about non-English speaking? What's going on with that? What's going on with churn? It's a hard thing to measure, but the concept is basically people who they were always eligible, but they left aid because of a paperwork problem. Okay. What do those numbers look like? And what the data dashboard allows you to do is compare your county to the state or to a neighboring county, or for that matter, any county. It works in conjunction with our counties. We asked for individual plans for how they were going to increase enrollment. And this is a way we can go back and measure, and we can provide technical assistance. Some of the key things in those plans were things like taking a look at the Medi-Cal population. We call that in-reach because those are essentially people who are known to the county. They're already on Medi-Cal. They're not all necessarily eligible for CalFresh, but a lot of them are. So that's called in-reach. And again, the data dashboard allows you to look at, well, how big of a target group do I have there, and how am I doing relative to others? Those are just a few of the things. Again, we want to do better. We think we're doing better than 63. We were doing 63 in 2012. We think the numbers for 13 and 14 are going to look better, but it's a priority for us.
I just want to ensure that those people that need the service know about the service, and we're not sending people to bed hungry when we have this federal entitlement, which means that if you qualify, you should get it.
Absolutely. And again, we see it as a problem of outreach, not wrongful denials.
If I can expand on one other issue. In my district this week, we had a call from a very angry gentleman from Lake Elsinore. And he said that he and his wife have been struggling to make ends meet, and he works for a large discount department store, the nation's largest, and his wife works also, but their hours ebbs and flows. And so he was getting a certain level of CalFresh EBT cards, a certain amount. Mm-hmm. And then when he had a pretty good month, where he and his wife were working, then he got a dramatic decrease in his allocation to feed his family. And so you mentioned before that there's a 6-month reporting that seems to be the state of the art today.
Right.
But if they reach a certain threshold, they are mandated to report. Right. So just my concern is as we try to lift people out of poverty, and there needs to be some stability in their finances. And it seems like we're penalizing people for being successful in finding employment because he talked with somebody I guess he was in one of the welfare departments, and talked with a gentleman that they were commiserating back and forth. And he says, "Well, how much do you get in your CalFresh?" He says, "Well, I get X amount of dollars." Right. And I said, "My gosh, that's like 3 or 4 times what I get. Are you working?" He goes, "No, I've been struggling to find work." So here he was complaining. Here I'm trying to better my lives for my children and myself. I'm trying to be gainfully employed, but I'm being penalized for trying to be successful and getting off the welfare rolls and getting off of CalFresh. So I don't know where we can improve the situation, but I think there should be, I think I've mentioned this in previous hearings, there should be a buffer period to let people try to get to a point of homeostasis, if you will, in their lives where they're working, they can provide for their children and not have to worry that the government is going to pull the carpet out from underneath them. So I don't know how you want to respond to that. It's just, and I don't know how to respond to this constituent, because I want to say to him, I applaud that you're going out to work, and I don't like to see that we're not helping you feed your children.
First of all, I agree with you.
Yeah.
There isn't a whole lot we can do, because we're talking about a federal program where they set the rules, and it is a means-tested and means-adjusted program. What I would say to your point about stability, I think is germane to this issue and really to many of the programs we operate. One slight wrinkle, it has more to do with CalWorks, but we have a program there where we talk about transitional CalFresh, where even as the client is exiting CalWorks, we sort of grandfather in their CalFresh benefit for up to 6 months, which I think is in the spirit of what you're talking about, that stability. Director Lightbourne, did you have more?
The only other thing I would add, Senator, first, with Todd, I completely agree with the spirit of where your question heads. And we do, we are under federal regulations. To the extent that we have flexibility in California, for example, in the CalWorks program, we're actually one of the very few states that have created the earned income disregard. So as people's earnings go up, they're not losing dollar for dollar. We're trying to sort of make it a bridge. And the transitional CalFresh post-CalWorks, we're sort of able to do that because of the title of the CalWorks program. But Congress is going to be looking again at the program apparently in the next months, and so the notion of trying to sort of bring forward the concept of saying this is a program that really should in some ways marry earnings and incentivize earnings is a concept that I think we should be promoting.
I think you said the key word, you said bridge. I think that was, and I like your example of the CalWorks program and transitioning and partnering with CalFresh. Any innovative approaches that you feel that this committee could entertain to help those, and so I can answer this gentleman with a logical answer, which is very difficult to explain to him the federal system and the mandates that come along with it. But here you have somebody that's trying to better their lives, and that's why we do what we do, because we want to help people rise out of poverty and become independent. And but we need to give them the tools to get from point A to Z, not getting them point from A to C, and then say you're off on your own for a while. So, thank you for your
Point well taken. We can relook if there is any flexibility in the way we've structured our mid-period reporting, but it was a very long, inclusive process about when a mid-period report would be triggered, and the implementing letter that actually implemented the semi-annual reporting was actually one of the first things that I approved. It was like 170 pages. But we'll, always good to think about, have we put the best, are we doing that the best possible way?
I wonder if there is an opportunity for the legislature to communicate your stated desire to Congress, and if it's a kind of an across-the-board desire for them to reevaluate federal poverty level, because so many of these programs have a cliff effect where you literally get a raise, or you have more hours one week and you fall off the cliff. Yeah. And it's this yo-yo kind of experience that if there was an updated view of the income eligibility for all these programs that was, updated like, quasi-current, because so many of them, the federal poverty level was designed, 50 plus years ago. And so I wonder if there's a universal message that the California legislature needs to send to Congress about eligibility determination on many of these programs, that it's simply too low and it's not realistic for the workforce in California today, people who have varied schedules and that kind of thing.
Yes, it's an absolutely uniform benefit. The benefit, and I shouldn't say that, I think Alaska and Hawaii have different numbers, but our benefit numbers are the same.
So just a couple of different questions, if I can. Sure. On the CalFresh program, is formula covered for babies?
I believe so, yes.
Okay. Diapers are not?
No.
So how would these people have to pay for it out of their welfare payments?
They would have to, if they were on cash assistance in CalWorks, they could pay for it out of that.
And tell me, women, infants, and children, WIC, how does that relate to all
That's
this?
administered by a different department, okay. But many CalFresh recipients pregnant women and women with children are eligible for that as well.
Are diapers available through WIC? They're not either. They're not.
Got-
We had WIC, the agenda was here, and they talked about the difference between WIC and CalFresh, and where CalFresh, where it's the EBT, where you swipe
Right.
and it's deducted, where WIC is no financial deduction, you just get the quart of orange juice or whatever
Right.
of all the items that are covered under WIC, but diapers aren't covered under any program.
That's a horrific expense.
Yes,
for
it is.
a lot of these young women.
Yes, it
and
is.
families. Thank you very much.
I think the questions that Senator Stone had and where we went were really all about sort of participation and your question 1 is written. So I think, could we move to question 2? With the implementation of the Affordable Care Act, there definitely were some opportunities for synergy between the two programs. As part of the Covered California application, there was a page in the application where you could indicate your interest in CalFresh or even CalWorks. And if a client did so in applying for that, there was a transmittal to the county of that interest, and then the county needed to follow up on that referral. So we did develop a referral system. In the other direction, basically CalFresh to Medi-Cal, there was something much stronger called Express Lane. I'm not our super expert on this, but essentially under Express Lane, you could basically more or less take that CalFresh eligibility, and it was almost categorical to Medi-Cal, and about 325,000 went that way. This is something that we'd like to improve on in the future. Later in the hearing, you're going to be hearing from our Assistant Director for Horizontal Integration. But this is an area where we think we can do better than just sort of a referral by saying, yeah, I was interested. We'd like to have it be more of a streamlined way where if you're expressing that interest, there's a way to move your interest forward more directly.
And just to add, one of the things we've been sort of engaged intensely with the federal control agencies, et cetera, is our ability to utilize information that comes through what they call the federal hub, which is what CalHERS, for example, uses for income verification purposes and identity verification. And what we've sort of been saying to Food and Nutrition Services is, can we rely on the information that CalHERS has already established via the federal hub? Heretofore, the answer has been no. Just in sort of recent weeks and months, they are signaling that they are trying to work something out between CMS and IRS so that we can access the information, or at least not access it, but rely upon it. If we can do that, that will facilitate a lot of streamlining that we're not, when somebody's indicated interest, we don't then go back to step 1 and say, can we see your check stubs? If you have been found to have income that's within the threshold, and if household composition matches the SNAP requirements, then we can rely more quickly. So hopefully we're going to see some movement on that at the federal level. Just administratively, it doesn't require legislation in the next 3 to 4 months.
Okay. Moving on to issue 2, our budget change proposal on page 24. As noted in your staff agenda, we do operate the largest SNAP education program in the nation, and it's been recognized by the federal government as very innovative. There are a large system of primary and subcontractors, and in reviewing the program last year, and as it was undergoing some changes, our federal oversight agency, the Food and Nutrition Service, urged us to have additional oversight. And we proposed, and they approved 6 positions and $747,000 federal funds. They essentially approved that as our final grant, made it really part of our grant. These 6 staff will conduct fiscal and programmatic reviews, improve oversight, and provide technical assistance to all SNAP-Ed local agencies. We expect to have better outcomes by being able to perform management evaluations as required and identify and share more best practices. And we would hope to deliver timely technical assistance and better support program implementation. This is something that we want, the federal government wants, and there was conversations with legislative staff last year as well. We hope you'll support our BCP.